Coronavirus precautions and treatments. Like most countries in the world, Pakistan is on the list of countries infected with the coronavirus. An initial wave of anxiety erupted across the country after the virus was first confirmed. Experts from neighboring countries feared the virus was infected by the medical experts. Despite Pakistan's efforts to raise awareness among citizens, including screening at airports and raising awareness among citizens, virus-infected people entering the country are a question mark on government performance. However, the importance of keeping the hygiene principles in daily life and the use of hygiene as a habit due to the coronavirus is still a factor in the good. There are several types of coronaviruses. Generally, the virus affects different organisms that feed their babies. It can cause diarrhea or obstruction of breathing, affecting their digestive tract. Coronavirus precautions and treatments. There are 6 types of it that affect humans as well. The World Health Organization has recently identified the virus as the 7th type of corona. This type of virus has never been found in a living organism, with no cure or vaccine available at the moment, which is useful to people suffering from the virus. However, medical researchers are searching for a cure. Day and night are consolidated, and it is likely that the vaccine will be developed by the end of this year. The coronavirus is not immediately fatal to human beings because of its effects. The initial symptoms are very minor. It attacks the respiratory system of humans. Usually, there is a problem with breathing problems and severe sore throat or itching. The initial symptoms include shortness of breath, fever, and cough, sneezing. Coughing, sneezing and fever are common in most of our homes, which rightfully triggered a wave of fear in our country, and people are beginning to understand that they have never been victims of this virus. Anyone who has traveled to Iran, China, the United States, Japan, Thailand, Korea, Taiwan, or any other affected country in the last 2 weeks and has a fever, cough, difficulty breathing or pneumonia, the relevant institution or doctor should refer to the coronavirus immediately. People who do not have these symptoms, but have traveled to another affected country in the last 2 weeks, should also undergo a medical examination. People who have not traveled abroad should also be cautious and take necessary steps if such symptoms are found. It takes only a few days for the coronavirus to infect and cause symptoms. Therefore, if a person is infected with this virus, it usually starts showing within 5 days. Sometimes symptoms take more than 10 days to appear. Preventing this virus is possible by taking some precautions. As such, your hands should be washed thoroughly and frequently. Should cover your mouth in case of cough or sneezing. Yes, we often use our hands. Under normal circumstances, this habit should also change as the germs from the mouth move to the hands, and joining hands with one another causes their continuous spread. It is important to try to cover the mouth with tissue paper when coughing or sneezing and keep your elbow in the mouth if tissue paper is not available. This can prevent the spread of germs. The virus usually transmits to other people by touching the affected person. Therefore, hand washing and coughing, sneezing should be followed by tissue, handkerchiefs, or elbow coverings. Animal carers should wash their hands thoroughly, change their clothes, and wear masks during their care. Healthy individuals do not need to wear protective masks on the face when in the elevator or at appropriate distances 3 to 6 feet from others. People needing to wear masks are taking care of coronary virus patients. Coronavirus has been diagnosed in several people in Pakistan at present. In addition, those who are suffering from colds, or coughing or sneezing should also use masks. Generally, many people have coughs or diarrhea in this season. They should not be worried. It is not necessary for all these individuals to have the coronavirus. Adherence to hygiene principles is essential to preventing such diseases. As a habit, we should adopt something that will cover the mouth, tissue, or elbow in case of cough or sneezing. We usually have no mouth covering when coughing or sneezing, and hands are used even if there is a cover. This method is not correct because attaching the hand to someone else is likely to spread the germ. The World Health Organization has also described the coronavirus as the safest way to take precautionary measures and says in its guidelines that wash hands with repeated soap.